The purpose of this open educational resource is to provide a demonstration of the bedside swallow eval, also known as the clinical swallow eval. The bedside swallow eval typically consists of 5 components: the medical history, the swallowing history, an oral mech exam, oral trials if the patient is appropriate for oral trials, and documentation. Not all patients are appropriate for bedside swallow evals. Some examples could include that the patient is too lethargic to complete the swallowing eval. Another example is maybe that the patient is NPO prior to an upcoming surgery. For these patients, it would be best to wait until they're medically appropriate to complete the bedside swallow eval. The bedside swallow eval is not a screening tool. Screenings can be completed prior to the bedside swallow eval. Advanced knowledge is needed to complete a bedside swallow eval, so speech-language pathologists are often the medical professionals who complete this eval. We will now continue with our oral mech exam demonstration. All right, now I'm going to be demonstrating an oral mech exam, which is part of a bedside swallow evaluation. Before we would complete this, we would want to make sure that we review the medical history, that we understand the reason for referral, that we touch base with the nursing staff, and make sure that the patient is appropriate to continue with the bedside swallow eval. So now I'll complete the oral mech examination. Hello, I'm Charlie. I'm a therapist here to assess your swallow. How are you feeling today?
I'm feeling good.
Good. Before we get too far, can I take a look at your wristband, and can you just tell me your name and date of birth?
May Fall 12319.
Great. And now, before we get started, I'd like to receive consent to perform the eval. So what we'll be doing is looking at your head and neck muscles, making sure everything's working properly. And then if you're appropriate, we'll want to try water, and some food, and make sure it's safe for you to eat and drink. Would that be okay with you?
Yeah, that's okay with me.
Okay, perfect. So we'll get started. The first thing I'm going to have you do is close your eyes. I'm going to touch different parts of your face. I want you to tell me right or left, forehead, chin, or cheek.
Okay. Right forehead, left cheek, right chin, left chin, right cheek, left forehead.
Perfect. Now I'm going to have you open your jaw as wide as you can. Now move it side to side, front and back. Perfect. I'm going to have you open your jaw again. I'm going to hold it, close it. Now open against the resistance of my hand. Perfect. Now what I'll have you do is raise your eyebrows, pucker your lips, smile, pucker, smile as fast as you can. Go ahead and puff out your cheeks with air. Now press, hold that. Perfect. Okay, now I'm going to have you do some different voice tasks. So I'm going to have you first open your mouth, stick out your tongue, and say ah, ah, ah.
Ah, ah, ah.
Perfect. Now go ahead and take a deep breath and say ah at a comfortable pitch and loudness for as long as you can.
Ah.
Great. Now I want to see your pitch range. So I want you to say ah and go from your lowest note to your highest note.
Ah, 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 ah.
Perfect. Can you cough into your elbow? Great. And I'm going to touch your neck. I just want you to swallow your own saliva. Great. Any pain with that?
Mm-mm.
Great. Now we're going to have you stick out your tongue like you're pointing your finger at me. Perfect. Wiggle it back and forth as fast as possible. Up and down as fast as possible. Go ahead and stick that tongue back out. I'm gonna press on it. Don't let me push your tongue inside your mouth. Great, and then the last thing that I'm gonna have you do is put your tongue in between your teeth and your lips and move it all around. Perfect. All right, thank you. Now we'll continue with oral trials.